I am Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. And today, if you did not know, is actually World Health Day. There's a focus around the world on health. At the world level, really a lot of looking at planet, environmental health, and how, as public health, do we work on ensuring that all across the world we're prioritizing environmental and human health, which of course are inextricably linked. It is also National Public Health Week, if you did not know that. So all week, the American Public Health Association has been lifting up the work of health departments across the country, not just on COVID, but on all of the environmental systems work that health departments do. Still, sometimes people don't know the difference between public health and health care. I sometimes think if you imagine yourself riding a bike or driving a car, when you have to take your car into the shop or your bike into the shop, the repair shop is the healthcare system. We need it, it's essential, we gotta get you fixed, and everybody needs access to it. But the bike path, or the road, or the highway is actually the work of public health. How do we create environments where you can keep moving, where there are not obstacles? And of course, we need both to make sure that the general environment that folks live in is part of how we think about health, as well as the repair shop. Chicago's current COVID-19 community level remains low. That is the most important piece of information that I want you to hear. As a reminder, about a month ago, the CDC started saying at all counties across the US, we have a 3-level system: low, medium, and high risk. And all across the country, we've been working to align our metrics as well as our mitigation recommendations for the level of risk. Go ahead. The COVID level, just when we are low, means that we are seeing a limited impact on the healthcare system. We are seeing low levels of severe illness. There is not a requirement to have masks. There are not even recommendations to have masks. We have not stopped paying attention to COVID. We continue to see cases, but overall, the outbreak remains in good control. If we were to get to the medium risk, we start to be more concerned. We see more impact on the healthcare system, more people with severe illness. If and when we get back to a medium risk, that is when, for example, CDPH would be recommending masks in indoor public settings, and we would see certain settings setting that as a requirement. I would expect we would see Chicago Public Schools, for example, make a decision to go back to a mask requirement. There are high-risk settings where we would have it. We would also be increasing, again, availability of certain resources. And if we got to high, that is when we would need to do some community level high mitigation, mask requirements, again, in public places, perhaps vaccine requirements for high risk public places, et cetera. But right now, still, we are low. I am not alarmed, although our cases are rising. I've been talking to folks across the country, and we are not alone in this. New York City, for example, is seeing an increase. They are also in low, but they are expecting that they may get to that medium risk level, possibly in a couple of weeks or so. And we also continue to monitor and would be ready to act if we saw more concern. So here is what the country is looking like. And again, the news remains good from a COVID perspective. All that you're seeing here in blue or green, depending on the color where you're looking, means that the counties are at low risk. You can see there are some parts of the country and even the state. Edgar County is the only county right now in Illinois that is having a little bit of a surge, a little bit of an outbreak. And so if anybody is going to Edgar County, I would recommend putting a mask on during the time that you're there. But generally, we are in good shape. You can see there are a few areas, just very limited, that are in orange, that are having real outbreaks. And those are the spaces where we recommend, not traveling if you're unvaccinated, definitely wearing the masks indoors. But knowing that it is spring break for many people this coming week, I am pleased with how the country is doing, recognizing that many people travel. If we compare this to some of the more traditional metrics that we're used to looking at, our cases per 100,000 population, nationally across the U.S., Everything looks good here. We're averaging 9 cases per 100,000 per day being diagnosed in the U.S. Of course, that is affected by how much testing is happening. We do a lot of testing here in Chicago and Illinois, and even in that context, both Chicago and Illinois are averaging just 11 cases per 100,000 people per day at a very, very low risk level. In Chicago specifically, we are averaging now 304 cases per day that are being formally diagnosed. And remember, that would not include people who are taking a home test, not having that followed up in a laboratory, but it includes every single laboratory test for anybody in Chicago or across the country. And we're able to take account for people who are getting tested not through the formal laboratory system. And that's part of why we look at positivity. So we're up from 238 cases on average a week ago to 304, but our positivity is still at only 1.7%. Very, very good. We want to keep it under 5%. We love it under 2%. It tells me we are testing more than enough and we are detecting COVID as it increases. You see there in New York City that the similar comparison where they are seeing an increase, not very dissimilar to what we have now, but nothing suggestive of the major Omicron surge that we saw in January. On the bottom graph there, that is showing Chicago data for COVID diagnoses for the whole epidemic. And so if you look, that big spike was in January, just this last January. The most cases, the most hospitalizations, mostly of unvaccinated people, that we ever had in Chicago. And because we have been hit so hard with the original Omicron, if you will, BA1, we actually are more protected than some places against BA2. The most important thing is to be vaccinated, especially in terms of preventing that severe illness. But with every passing day, I am more confident that in the very short term, we will avoid a major increase like we saw with the Omicron surge. I also want to highlight what's happening with our deaths. We have the fewest number of Chicagoans dying of COVID right now than we have ever had since COVID hit the city. February 28th, which happened to be when we lifted the mask requirement, although this wasn't why, it was the first day in all of 2022 that 0 Chicagoans had died from COVID. And before February 28, the last day we'd had a 0 death day was July 24th, 2021. And we've only gotten better since February 28th. They're at their lowest point ever. We had 0 COVID death days on March 15, 17, 19, 22, 23, 24, 26, and so on. And we are currently averaging less than 1 COVID death in Chicagoans per week. This is amazing. And this is thanks to all of you for getting vaccinated, first and foremost, for wearing masks during the time that we are in major surge and need to decrease that risk, and for continuing to take care of yourself and others. Also, if we look at hospitalizations, we are seeing fewer Chicagoans being hospitalized with COVID than at any point since July 2022, and almost the lowest that we have ever been. We're currently averaging just 7 Chicagoans being hospitalized with COVID each day. The lowest we've ever seen was 6. So we may still hit it in the next few days if we continue to see some decrease. But in comparison, there's about 7 Chicagoans across all of the city getting hospitalized each day. You go back to just January 4th, 301 Chicagoans hospitalized in a single day, newly that day. And we have hospitals, big hospitals, right now in Chicago with 0 COVID patients in them. I cannot tell you how exciting that is. And we are seeing that despite seeing some increase in cases. And I want people to understand that we are in a different point, mostly because of vaccination, also because of the recent Omicron surge, that we continue to be in quite a good place, even while cases continue. Here's what's happening with variants. So remember that everything has been Omicron since approximately the end of December here in Chicago, in the Midwest, and really across the US. And the original Omicron version, B1.1, was everything that we were seeing initially. And then came this subvariant that you've heard about called BA2. It is still Omicron. The good news is genetically, it's quite similar to Omicron B1.1. And so For people who recently were infected with B1.1, we would not expect them. There's more than a 90% protection against BA2. So one thing I want people to hear is if you had a breakthrough infection, in that January time period that most likely was Omicron, you have additional protection, we expect. Not 100% protection, but good protection against BA2. That paired with being up to date with your vaccines should help keep this in control. In Chicago and across the whole Midwest, BA2 is now making up more than 2/3 of our cases. So by far, most of what we are seeing is BA2. Not a surprise, it is more contagious than B.1.1, but nothing leading to a major surge. And if you look, there are other parts of the U.S. actually quite a bit ahead of us. So across the whole U.S., here we're about 67% BA2. Across the whole U.S., it's about 72%. And if you look in the Northeast, it's over 80%, pushing 90% of that BA2. And so it's not surprising that in places where BA2 has really come to be the most predominant, there's been a little bit of an increase, but again, largely not turning into hospitalizations and deaths. And as I noted, we are seeing very similar case increases in other parts of the U.S. These are some of the states that are having increases right now. That red line that you see is cases. And so compared to the huge surge all over the country, what we are seeing right now are small upticks. And importantly, the other colors, the orange and the gray, show hospitalizations and deaths, which have remained very low across the country. That's not true across the world, though. I want to highlight that everything that you are seeing in dark purple on this map, certain countries in Europe, parts of Asia, Australia, New Zealand, are seeing rates of COVID corrected for population right now higher than they have ever seen, and significantly higher than we saw here even during the Omicron surge. And I want to talk about that. On this map here, this is showing the average number of daily cases per 100,000 people. So I told you here, in the US, we're in the sort of 9, 10, 11 range. Those dark purple are over 70. So more than 7 to 10 times corrected for population. And let's actually look at Australia versus the US just to kind of understand what is a little bit different here. And so these graphs are showing in green what's been happening with cases in Australia and cases in the US in red, corrected for the size of the population. And you see that in both Australia and the US in January, that's that first surge, we both had a big surge. In fact, Australia had way more cases per population and was actually doing less testing, and so had a positivity that was even higher. We know their cases were even higher than this. Some of this is because they'd been aiming for a zero COVID approach, and frankly, Omicron is so infectious that even being fully vaccinated, although it decreases your risk of infection, we do see a lot of breakthrough infections. But what we saw in Australia, similar to many other countries, is that in Australia, those case rates in green came back down in February, but not all the way back down. And then they're in a second surge right now that is that BA2. And again, this is partly because in Australia, we've got a lot of people seeing COVID, getting COVID for the first time, but they are not getting seriously ill for the most part. And they're tolerating without needing to close schools, without needing to do major mitigations because they are highly vaccinated. The US in comparison is not. This is, if you go to the next, positivity. And I do want to highlight this. Again, Australia in green and red in the US. At the peak in January in the US, we had a 30% positivity. The highest we ever saw here was about 20%. And right now in Chicago, we're at 1.7% positivity. The US is below 5%. Australia is at about a 50% positivity. 1 in 2 tests is coming back positive. And finally, though, if we look at hospitalizations, red is the US and green is Australia during this same time period. So at the time when Australia was seeing so many more cases than the US, their hospitalizations were less than half of what we were seeing. And that huge second surge that they're seeing with BA2 is having a little bit of an impact on hospitalizations, but nothing compared to what we had here with Omicron. And that is completely related to the differing vaccination rates. And this is why we push not 100% vaccination, there's underlying conditions, et cetera, but Australia is really quite similar in terms of access to healthcare, resources, et cetera, and vaccination is the main difference driving this here. And I do want to highlight that even in the setting of more breakthrough infections that we've seen during the Omicron surge, that we probably will continue to see to an extent in BA2, especially we're seeing people get COVID for the very first time. They're not getting seriously ill almost all of the time if they're up to date with their vaccines and their boosters, but we're seeing people get COVID. I want to highlight that the vaccines are working beautifully still against severe illness, hospitalization, and death. This is Chicago data. 99.77% of fully vaccinated Chicagoans, even leaving aside the booster, just you finished your primary dose, have not subsequently been hospitalized for COVID-19. That's 99.8% rounding up. If people who were fully vaccinated didn't end up in the hospital for COVID. And 99.97% of fully vaccinated Chicagoans have not subsequently died from COVID-19. This is an amazing vaccine. And my biggest worry still are Chicagoans who are not protected, and it's what we continue to be focused on at CDPH. Here is what our vaccination rates look like across the whole city. You can see in darker blue, these are the community areas. The darkest blue, more than 90% of eligible Chicagoans have had at least a first dose, whereas as the colors get lighter, we have some areas that still less than half of the people, less than 50%, who are eligible for a vaccine have had one. And we continue to focus on this, but these are the areas that drove our Omicron surge, our hospitalizations and deaths especially, during January, and they remain at risk. If we look at vaccination rates by age, the majority in every age group have now had at least a first dose of vaccine. We're making great progress on 5 to 11-year-olds. About 53% have had a first dose, and all of our other groups, except for those over 80, are over 80% vaccinated in terms of the first dose, which is great. People over 80, still highest risk for bad COVID outcome, still lagging the rest of the city in vaccination. If you know anybody over 80, the most important thing is getting these folks vaccinated. And by race ethnicity, we're also continuing to make progress every single day. Still, we are seeing Asian, non-Latinx Chicagoans be most likely to be vaccinated. About 85% of eligible Asian American Chicagoans are vaccinated. We see more than 3/4 of both white and Latinx Chicagoans have been vaccinated, and about 62% of Black non-Latinx Chicagoans have had that first dose of vaccine. And that worries me because we have seen COVID more and more disproportionately, especially the bad outcomes landing on Black Chicagoans. However, on the good news front, Black non-Latinx Chicagoans are leading in first and second dose vaccination uptake since the beginning of March 2022 here in Chicago. And so these graphs are showing that's people getting their first dose on the left and people getting their second dose on the right. That purple line are Black Chicagoans, and it's been good to see day after day after day in the group that we have the most catch up to do, seeing people take advantage of that vaccine. There are more than 5 billion people around the world who are now vaccinated against COVID. More than 11 billion COVID vaccinations have been given. No safety concerns, and really, really good effectiveness. So this has been great. Our vaccination Protect Chicago at Home program continues very strongly. We are currently offering appointments Saturday, Sunday, Monday, and Tuesday, 8 a.m. to 6:30 p.m. You can get a first dose, a second dose, a first booster, or a second booster through this program. All COVID vaccines remain free for all Chicagoans, and they will, regardless of your income, regardless of your insurance status, regardless of your immigration status. When should you get that first COVID booster? Anybody over the age of 12 should have 3 COVID vaccine doses by now, unless you got started a little bit late. Anybody over the age of 12 should have 3 COVID vaccine doses by now. As long as it's been 5 months since they completed the first series of either Pfizer or Moderna, or 2 months after completing J&J. We are not doing that well on boosters. Less than half of the people who are eligible for a booster shot have gotten one. And we saw during Omicron, for example, people who were vaccinated and boosted 21 times less likely to die of COVID than people who were not vaccinated across the country. Who's eligible for that second COVID booster dose? There's two main groups that are eligible: any adult over 50 and anyone over 12 who is moderately or severely immunocompromised. I'm going to be honest with you. This is the same vaccine formulation that we've been using all along. It's the same Pfizer, the same Moderna dose, and you do probably get some additional protection, but it's not as great additional protection as you got from the first, the second, and then the third. The CDC and the FDA have decided to make it available because in Israel, where they did a fourth dose, they saw people who got the fourth dose were less likely to die of COVID. That said, I think people who choose to get a fourth dose are probably also being more careful about COVID in some ways. They're probably more likely to be masking and taking other care. And so the problem is, if we were to see a significant surge, masks work right away. Right from when you put a mask on, we start seeing protection for you and everybody else. Vaccines, if you have a significant surge that comes, they take a couple of weeks to take effect. It takes time to ramp that up. And so right now, when we are at a good point and we have vaccine available, especially for folks who are higher risk for those outcomes, can get that second dose and have some more protection. But I don't want people to think that this is something that everybody has to get. My expectation is that perhaps in the fall, we may see a new formulation of a COVID vaccine that is more specific for variants. There hasn't been a decision made on that, but I think we may be, ahead of the winter, looking at a booster again for everybody. But in the meantime, I'd say if you're over 65 or you're over 50 with an underlying condition, certainly if you're immunocompromised, I don't think there's a downside. There's not a safety concern. It doesn't hurt your immune system. It's free. It's available. Getting a second COVID booster dose can help. But the most important thing is that everybody in your network has had those first three. If I had a choice between, my mom getting a fourth dose and knowing that everybody around her had had three, I would want everybody around her to have three more so. You can get that second COVID booster 4 months after getting a first booster, and you can get either Pfizer or Moderna. The city has been working to actually call Chicagoans who are high risk and have not had a booster or are otherwise missing a dose. And so we've started in our lower vaccination zip code, so don't be surprised if you get a call from our call center. We've been scheduling people for at-home appointments, and last week, not counting second booster, we saw an increase in vaccinations from the previous week, our first increase in over a month. That's great to see us being prepared as a city for whatever comes from COVID. The first and most important thing is getting folks vaccinated and boosted. I also, while we are at a moment of relative calm, strongly encourage all Chicagoans to have at-home COVID tests available, sitting on your shelf. You can get free at-home COVID tests by going to covidtest.gov. The only thing you have to put in is your address. They're not going to ask you anything else about you, your insurance, anything. It's through the Postal Service, and you can get 8 free at-home tests. If you already ordered your first set, order a second set today. I would like nothing more than at a time when most of the U.S. is not concerned about COVID. I am also not very concerned about COVID right now, but I'm worried that if we were to see a surge, we want to have testing widely available. The health department is also purchasing additional COVID-19 at-home tests to have in case of a surge. We, of course, are planning and preparing for whatever might come. My hope is we don't need to use them, but this is something you can do right now to be more prepared if you are concerned about COVID. As a reminder, nothing has changed on isolation and quarantine. If you catch COVID, regardless of your vaccination status, you must stay home for 5 days. If you're feeling better after 5 days, you can leave your house. We're seeing a lot of people again with mild breakthroughs, but you must continue to mask while around others for days 6 through 10. That's true if you're going to school. That's true if you're going to work. That's true if you're just out and about. That has not changed and will not at any time. And finally, in terms of you being prepared, if you're worried about COVID, we want you to get vaccinated. We want you to have at-home tests ready to take in case you have symptoms or are worried. And finally, we want you to have a plan in case you or someone you love gets COVID. All along, we've said, think about what would it look like to be able to isolate within your home, to make sure folks at home have masks. But also, we have new, very effective early treatments for folks who are diagnosed with COVID. Paxlovid is one of the oral medications, the pills. It cuts the risk of being hospitalized in people with severe underlying conditions by 90%. So if you get diagnosed with COVID and you are older, over 65, or older with an underlying condition or otherwise concerned, we need you to reach out to your doctor to see if they recommend early treatment for COVID-19. You have to see a medical provider to get this treatment. You can't just pick it up. They need to look at the other medications you're on. There's more to it. You need a prescription. But we have this available, widely available at this point in Chicago. We're ramping it up again in case there is a significant surge to make sure we've done everything we can so that even people who may not be insured can access it. But right now, if you do not have a primary care provider, get one. Get one so that you should have one anyway for protecting your health. But then also, if you were to get COVID, you're already set up for getting this treatment. If you're insured, you can look at the back of your card and call the number on that card or go to the website and see what's available. If you're not insured, our federally qualified health centers, community health centers, will take anybody who is uninsured, who is undocumented, and you're welcome to call our call line, anybody who needs help with that. This is our call line, 312-746-4835. We continue to answer your questions, get you set up with vaccine, get you set up with testing, can help you sort out getting a provider or anything else you need. And we are keeping this open 7 days a week, remain very, very focused on making sure there are not barriers to people, especially around vaccination. Finally, as we think about this moment, a lot of people are worried. I know that. And I want you to hear that I am as concerned about how we recover from COVID related to our mental health as I am our physical health. And so I want to remind you that life is better with other people in it. And at this point, when COVID risk is relatively low, I really do want to encourage you to be making some of those social connections again, if you have not. I want to encourage you to be leaving your home. I want to be encouraging you to get some of those social connections going again, because we know it's one of the easiest things that you can do to help with your mental health. We also have invested a lot of additional funding under Mayor Lightfoot with the American Rescue Plan money as well. We have an $89 million budget this year for Chicago mental health. That's 7 times what we had in 2019. We're funding 38 clinics in 35 community areas to make sure they're open to all. We'll be expanding to all 77 community areas this year. We're embedding mental health professionals in 911 response for the very first time and expanding that. We're working to really bring mental health care out of the clinics, making sure people can access if they're coming to a food pantry, if they're coming to other settings. We're working with Chicago Public Schools. If there are students who have additional mental health needs, make sure they can get into care. And we're investing in the CDPH mental health clinics. You're going to see more about this. We'll be starting a campaign called Unspoken, which is about turning mental health into something that we talk about, no longer having it be unspoken. So you'll hear some more about that. And finally, around the city, you're going to see some new murals and some new art. We've had a number of collaborations with artists in Chicago to help us promote vaccine, to help us promote community growth. And so this is an example of one of the mural unveilings that happened. This is another one. This one's on East 71st in South Shore. And then finally, there are going to be street pole banners featuring local Chicagoans art. Again, promoting vaccination. It remains the keystone of us being as prepared as possible for whatever comes next. And with that, I'm happy to take your questions.
Do I really need the microphone?
Yeah, well, so the people
okay.
being streamed.
All right. It's been about 3 weeks in a row that you've not been really concerned about this new variant. So do we think we're over the hump here?
I don't think we're over the hump, probably, in terms of this increase in cases or with BA2. I don't, of course, know for sure, but looking ahead to what we've seen in some other countries and even some other parts of the city, if I had to guess, I would say probably for at least the next couple of weeks, we are going to continue to see some gradual increase in cases. We're probably going to see some gradual increase in positivity. We're watching really closely for any signs of more significant concern. But I think similar, if you think about how, like, when the Alpha strain came through, we sort of had this relatively limited surge. I think that's what this is going to look like. We need to get to a point where BA2 really is almost 100% of what we are seeing to really feel confident that we are seeing its full impact. So if I had to guess, April is going to be a month for the most part of continued slow increase. And if we see signs of any concern, of course, we will be out and notifying people. But I need folks to understand that the increase in cases is not the only thing that we are looking at. 200, 300 cases a day means something very different than it did before we had vaccine. It also, 200, 300, 400, 500 cases a day means something very different from last summer when we were testing a third as much as we are now. And so I know there are people who are really concerned about those case numbers. And I share, I'm glad you're watching. And we have a lot of people watching this really closely. If we see anything that suggests an outbreak that is going to be out of control in any way, or if we need to take those mitigation actions, we absolutely will do it.
Do you have any idea the percentage of people that are taking home tests and not reporting anything to CDPH?
Yeah. So there have been a number of ways to sort of think about this and estimate this. One thing is the CDC and sort of across the country, they've been looking at purchasing and uptake and sort of who is ordering the at-home tests, et cetera. You, of course, don't know just because people have ordered a test whether or not they've taken it, but it gives you a sense of who has sort of bought into that. I think across the whole country, I was listening to a really good conversation yesterday. The advisory council to the FDA met, and they were looking at vaccination sort of planning, looking at some of the science around that. And they are estimating that perhaps it could be as many as 5 times as many people have COVID as are being formally picked up in surveillance systems, meaning that are getting tested. That does not mean that there are 5 times the number of folks taking home tests, because we also know there are people who may have very mild symptoms and never get tested. But when we are using sort of our estimates of where we are, generally, depending where you are in the country, the estimate is that probably the true numbers are in the 3 to 5 times range of overall kind of the official numbers that we're seeing. Here in Chicago and in Illinois, where our testing numbers remain very high and our positivity remains very low, I would estimate we're more at the 3 times mark. And I want folks to know that throughout all of COVID, we have never counted every case. We have reported out every case. But you look back at the very beginning, for example, there was very limited testing available. Folks were really only getting tested if they were, seriously ill enough to get in the hospital. We know that case count is a dramatic undercount, at least 10 times of what we were. And I'd say at this point, where you look at all the data, there's probably about 3 times as many people in Chicago being diagnosed. But that's not significantly different from what we've seen before. It's just that there are now more people doing the home tests.
And then boosters, they have been low kind of consistently. Why is that? And is there a concern about that, especially since vaccines wane so quickly and we're already talking about a 4th dose?
Right. So I would say a couple things. First of all, it's been really clear that those first 2 doses of vaccine are the most important in terms of preventing severe illness. You know, you see this huge drop in hospitalizations and deaths after those first 2 doses. And so I think as public health agencies, as people generally, we've pushed really, really hard on the first 2 doses. And I think honestly, when that first booster came out, there wasn't as much data that it was clearly going to have a significant impact. And so we recommended it, we promoted it, but kept a lot of that initial focus on the first and second doses. What we saw here in Chicago and across the US was that getting that booster dose clearly made a difference. But we only knew that for sure in retrospect. And that is not that dissimilar from where we are right now with that 4th dose. You're thinking about booster recommendations often because you have sign of something showing some concern, but you don't have all of the data showing how good the protection is going to be. I think that with each additional dose, you do get probably some additional protection, but unless there is a major change in the way the vaccine is made, each additional dose is giving you sort of a little bit less and less protection. And that's why this time around, you know, the recommendation for that 4th booster is really just for folks at highest risk. I do want, and that's part of why we are now calling people who are higher risk and missing that first booster, is because I just want Chicagoans to be protected. And we are putting more I think, effort into messaging around that and trying to help people understand. But it's one of these things that, you know, I would trade all the boosters for everybody having had their first and second dose, right? But you can't. And so for people who are eligible, I really want folks hearing that getting a booster is important, but I don't, and my other worry is I think there are some people who say, oh, because it was a booster, the vaccine isn't working. That's another thing that I hear a lot of. Why should I get another vaccine? They're just going to tell me to keep getting a vaccine over and over again. It isn't working. It isn't helping. And I want to just say that that's not true, that the vaccines do help. They do not protect. No vaccine 100% protects against infection. And Omicron is so contagious, it's so infectious, that we do see more people getting COVID, even if they've been vaccinated. But getting vaccinated significantly cuts the risk even of getting COVID, and getting that booster cuts it even further. So we're pushing that 3rd dose, especially now, but I expect that if we do have a more variant-specific vaccine come the fall, that will be a bigger push for everybody. And we're in a little bit of a holding pattern in the meantime.
Right, and that's up for debate about this,
Correct.
About the 4th dose. I mean, so if you're over 50, between 50 and 65, not high risk, do you suggest just, and I know it's up for debate, many doctors have different opinions on this, do you suggest maybe just waiting for that different dose in the fall? Yeah,
well, I like the way you put that. If you're, sort of between 50 and 65, you don't have the underlying conditions. I think here's what I would say. There's not a downside to getting a booster right now. I want people to hear that just because, if you're in that group, if you get a 4th dose now, it's not that you would still be eligible whenever, if we do have a variant-specific vaccine. You also, and I have actually asked this question of some of the scientists because I wanted to make sure I understood this well. There's no concern that getting another dose in any way makes your immune system less responsive to a future vaccine. There doesn't seem to be any negative immune response at all to getting a vaccine. There's no new safety concerns, et cetera. I'd say if somebody is in that 50 to 65 without underlying conditions, there's not a major need to get it. But if they're concerned, certainly if their doctor recommends it, can get it. I would say, especially if somebody in that 50 to 65 had Omicron, there's probably not a need. But for someone who hasn't, we know that is when the risk goes up for more severe COVID. And so it is a little bit of an individual decision. I know that can be harder for folks, but I would say, I am recommending to people I know who are over 65 or over 50 with an underlying condition to go ahead and get that 4th booster. And you should have that conversation with your doctor if you have specific questions. All right. Thank you.